Ladies and gentlemen, welcome to this new segment of Medcast, your gateway to the latest medical updates and trends. Today, we are so pleased to have again Dr. Nisreen AlMusaileem, who is a consultant in otolaryngology, head and neck surgery. She is also subspecialized in pediatric and adult rhinology, sleep surgery, and facial, plastic, and reconstructive surgery. Welcome, Dr. Nisreen.
Thank you, Dr. Ali.
Hopefully, I have said it right this time.
It's all perfect.
Alhamdulillah. Dr. Nasreen, I know there are so much parents are concerned about their children's health, especially when they are having difficulties while sleeping. So I think there are so many problems that is related to their sleeping pattern. One of the most common problems they have is the sleep breathing disorders. Could you please explain more about the sleep breathing disorders?
Sleep breathing disorder is comprises many stages of sleep breathing disorder.
Mm-hmm.
Like the first stage, which is the lightest, I mean the simplest, the mild form, which is open mouth breathing, like mouth breather during sleep. And then it can get worse by snoring, and then by stop breathing, which is apnea, like the child will stop breathing,
Mm-hmm.
and they will have like problem breathing during sleep.
Mm-hmm.
So it has many stages, and the first one is mouth breather.
Okay, that's very good that you have mentioned the most commons we have in the society. But how can we advise the parents on how they would identify if the patient is having difficulties during sleeping or not?
Most children, they will breathe through their mouth.
Hmm.
That's the most common part of it,
So that can be seen clearly.
seen
Yeah.
clearly.
Mm.
And you can also uh, like listen. They will snore at
Mm.
night, and sometimes during snoring they stop breathing,
Mm.
like, and gasp, wake up and gasp for air for a few seconds,
Mm-hmm.
or cough at night, like recurrent cough or recurrent gasping.
Mm.
And also it's associated with bedwetting, sweating, and restless sleep.
Mm.
So, like, and they always like extend their neck, and extend their neck and
Airways.
head,
Yeah.
yeah, just to open the
Mm.
airway
Mm.
during night, like during
Mm.
sleep. So if you see these signs, like, patient need to be taken to
To the doctor
to
immediately.
ENT
Okay.
and check them.
How can we know the potential causes of the sleeping disorders?
Uh, n- so 90%, most of them are caused by the most common one is adenoid and
Mm.
tonsil enlargement, and it's easy to diagnose, easy to treat. They need surgery, uh, but some of those patients, like, there is an more underlying problem,
Mm-hmm.
other than adenoid and tonsil, and need more specialized ENT surgeon to check the other underlying problems. Yeah,
So that's what is related to your specialty.
yeah, that's my
But I
subspecialty.
think and I believe that one of the most common causes we have in the society is obesity, which is very common now in the society. Would you consider obesity one of the causes of sleep apnea?
No, in children is not. In adult, yes, it is. It
Mm-hmm.
is one of the common causes, but in children, it's no. Mostly, they have nasal allergies and or recurrent viral infection, causing this adenoid and tonsillar enlargement that can be easily solved. But obesity in children is usually, still a child can manage the airway even if he's above the 95 percentile.
Mm-hmm.
And most our children are between the normal percentile of weight.
Mm-hmm.
And it's very rarely that the cause in children is an obesity.
Okay, I
Yeah.
have insisted to mention that because some parents might think if the patient or the child is somehow obese, that might be a cause that they could wait for rather than going to the doctor immediately. So if they see their child is a little bit obese, the father might tell the mother, let's wait until he lose some weight and then we would go to the doctor later on. So if the patient is having sleeping apnea, will that affect the quality of life?
Oh, of
Yeah.
course, yeah. Especially a child is he's developing,
Mm-hmm.
and it will affect his development, mental development, personality development, and growth, his own growth, like intellect and growth. It also affects like his mood and temper.
Mm-hmm.
Like you can notice that they are usually hyperactive, cannot like they have low attention, poor attention, that leads to poor performance in school. They always have disinterest in eating.
Mm-hmm.
They don't want to eat, or they only want to eat junk. And they usually have, most of them, they have ADHD because of the sleep breathing disorder.
Mm-hmm.
And we published one paper on this at Boston University while I was in Boston, and it was about how breathing during night can improve ADHD.
Mm-hmm.
And we found that like 67% improvement, and some of them cured after improving their breathing.
Mm-hmm.
Like we improved it surgically in many ways, like myofascial therapy, physiotherapy. So we just let the child breathe from his nose and not from his mouth
Mm-hmm.
by any mean,
Mm-hmm.
like by surgery, by us, ENT surgeon, by myofascial therapist, by all other means, by dental work
Mm-hmm.
with dentists. So we have multidisciplinary approach to approach those children.
Okay, that's great. Now, with the medical guidelines we have for the other diseases, we normally start with a lifestyle change as a good starting for the treatment.
Yeah.
Now, for the sleep apnea, could we say that lifestyle change could affect the sleep apnea in a positive way?
In an adult,
Yeah.
yes, but in a child, mostly, you need to know, you need to figure out why the child is breathing
So
from
you need
his
to look
mouth.
for the main reason.
Yeah,
Yeah.
like it's an airway,
Mm,
mostly an airway problem,
mm,
and uh, and it's usually caused by either like using pacifier, for example. One of the causes
mhm,
of children sleep breathing is like using pacifier, or using the feeding bottles for so many like longer period
mhm,
than the normal period, and that will cause deficiency in the muscles, or in the mouth muscles,
mhm,
and usually these children tend to open their mouth to
mm,
breathe, and they eliminate the nose. Or it's the opposite, like they have problem in their nose, forcing them to open their mouth to breathe.
mhm,
So we as ENT, we usually figure out if there's any problem in the nose and solve it,
mhm,
whatever the causes, and figure out why they cannot close their mouth
mm.
and breathe only from their nose. And the good news is mostly solvable. The problem in children can be solved, and easily solved.
So regarding the solutions you have, you may not need to make a surgery for a patient.
Um, Mostly, yes.
Yeah. So
Mostly.
when is the best time to decide if the patient is needing surgery or not?
So, for if it's tonsil and adenoid, we usually do it as soon as possible if it's causing breathing
So
disorder.
let's say if there is something physical that is causing the breathing obstruction. Yeah.
Yes, yeah, as soon as possible.
Mm-hmm.
And if it's like obstructing breathing, the problem at very young, like younger than 2, you need them to breathe from their nose so they can feed, because we born as compulsory nose breather.
Mm-hmm.
So they will have problem with feeding, they cannot breathe.
Mm-hmm.
And then later on, they will have problem developing
Mm-hmm.
if they cannot breathe. So if there's an obstruction and that can be surgically relieved, we usually relieve it as soon as possible. Regarding other surgeries like the sinus and delicate nasal surgeries, we usually need children to rinse,
Mm-hmm.
like for a period of 3 weeks at least after surgery. And if the usually children less than 4 cannot rinse.
Yeah.
So for these delicate surgery, if there is an obstruction, anatomical obstruction or whatever causing limit the nasal breathe, we usually interfere after 4,
Mm-hmm.
when they can rinse the nose.
Okay, that's great. Now,
Yeah.
from doctor's perspective, if the patient is brought to you, is there any diagnostic test you would do it to the patient to know if he's really having sleeping apnea or not?
Yeah, we depends. I usually depends, and my fellows, all colleagues, we depend on clinical exam
Mm-hmm.
at this age group. We depend on clinical exam, and I usually do questionnaires
Mm-hmm.
just to know the severity, to confirm severity. Because if it's severe, I usually intervene faster.
Mm-hmm.
If it's not that severe, I usually give them a period of medication and see if they can improve with medication.
Mm-hmm.
And uh, and uh, and we usually, if we found a clear obstruction, we usually treat the obstruction and like treat them with surgery. But cases, if there is no clear obstruction and we need to interfere in a like a very extensive method, like major surgeries, we usually send them to sleep medicine, and they give us a hint of how badly is the sleep apnea.
Mm-hmm.
And at that level, we can first pre-medicate. Like we have to give them a period of CPAP or whatever to breathe at night before intervening, and take them right away to the OR and do the major surgery.
Mm-hmm.
And because most of them like cannot tolerate, if they have like a big tongue or whatever, need a major intervention, and they cannot tolerate it, and they might get into complications after surgery. So we need to take the process if it's not as simple as adenoid and tonsil or nasal
Mm-hmm.
obstruction or problem with mouth, they cannot close it. And don't forget the part that the dental people, like the dentists, usually sleep dentist, uh, I usually check for those children if they need dental expansion, maxillary expansion. If they have, usually because of sleep apnea, like prolonged sleep apnea, the growth of the face, like they grow in elongation, and instead of having a wide maxilla, wide mandible, and a good airway, their nose is usually their nose and maxilla will be narrowed, and their face will have longer faces.
Mm-hmm.
And usually we intervene with dentists at age of 6 or 7 when they start to get the permanent teeth.
Mm-hmm.
And it's a multidisciplinary approach, but it's usually simple. In children, it's usually simple. It's usually something obstructing the nose, and we solve it, and that's it, and they will be very happy.
Now, one of the reasons you have mentioned that may cause sleep apneas is tonsillitis, is it?
Yeah, enlarged tonsil.
Okay.
Yeah.
Now, one last question, because some parents might feel frustrated when they hear at this age
Mm,
the patient would be required to remove the tonsils or
tonsil.
make a tonsillectomy. So, is it somehow required to remove the tonsils at this age? Is going to be like long-term effect on the patient or not?
No, actually, like usually adenoids decrease in size by the age of 5,
Mm-hmm.
and tonsil decrease in size at the age of 9,
Mm-hmm.
and they don't need them afterwards.
Mm-hmm.
Like it's the importance of these two lymphoid tissue is the early life.
Mm-hmm.
It's in the early life, and if it's enlarged, it will cause a catastrophe and a complication much more than the benefit
Yeah.
of their as a lymphoid tissue in this area.
Mm-hmm.
So uh,
I'm pretty sure that when you have the
yeah,
decision to make the tonsillectomy, you will have the final decision, which is goes better for the patient. Yeah.
exactly.
So
Yeah.
you won't be against the patient in any way. Yeah.
Yeah, luckily, most of them they trust you.
Yeah.
They
Surely.
trust you.
Yeah.
Yeah, most of them. And if I talk to them, even if they don't have the knowledge,
Mm-hmm.
just give them a few statements, and tell them that this is the best thing, and that's better for them. I notice, like, if you talk to them, give them like 5 minutes of education, they will agree right
Yeah.
away.
Definitely.
Yeah.
Yeah. Dr. Nisreen, we are so pleased to have you today. Hopefully, we can have you again here.
Thank you so much,
Thank you
Ali.
so much.
Thank you.
Our dear audience, we have reached to the end of our segment of Med Podcast today. Hopefully, we can meet you again with another medical specialist. Until that time, see you later.